Right. Thank you, George. Good afternoon, everyone, and welcome. This is the Dorset Council People and Health Overview Committee. I'm the chair, Beryl Ezard from Wareham Ward, and I'd like everyone here that are members of this committee and welcome you, because I missed the last one, I'm afraid. I was on holiday or something. But Louise, the vice chair now, stepped up, which was really good. So if we can introduce everyone that's now on the committee, please. Let's start with Louise.
Hi,
Oh, sorry.
Thanks, Beryl. Hi, I'm Louise Bown, Vice Chair of this committee, and I'm member for Radipole Ward, which is in Weymouth.
Stella Jones, Dorchester East.
Ryan Holloway, Wareham Ward.
John Orrell, Melcombe Regis, which is Weymouth Town Centre.
Alex Furman, The Mighty Westham.
Byron Quell, Blandford.
Steve Mercer, Blackmore Vale Ward.
We've got online Mike Parks. So, Mike?
Councillor Mike Parks, Ferndown North.
And I understand that Jindy should be arriving any minute, and I know she can't stay till after 3:15, but I'm hoping that she'll be here. So just to say that when we have finished the paper, it'll be just the committee members to ask questions first, and then any other members that may be here to ask questions afterwards. We don't tend to have, one or two. We've got, Steve Robinson at the back there. So welcome, Steve. And welcome to the officers and corporate directors here today. And let's get straight on then. We've got now, any apologies apart from who's mentioned? No apologies. All right, thank you. Declarations of interest. If anyone's got a declaration of interest, can they say now, or will they we've only got one paper, so anyone? No. Right, minutes to confirm the minutes of the last meeting on the 19th of May. Is there any questions or matters arising from the minutes? Unless it's about their accuracy. Everyone happy with that? Yeah, okay, George. Public participation, we've no questions from the public, and we've no questions from councillors, and at the moment there is no urgent items unless something crops up during the meeting, okay? Thank you. And now we go straight into item 7, which is the Families First for Children Pathfinder update. And unfortunately, we've got Claire Sutton is having some problems and can't make it today, here or online. So I think Paul Dempsey, our Corporate Director for People and Children, will introduce the paper, please.
Thank you, Chair. I'm Paul Dempsey, Executive Director for Children's Services at the Council. I'll just do a brief introduction to this paper and then pass on to my colleague Paula Golding in a couple of minutes. So this report is an update on our progress as a Families First Pathfinder authority. You will recall, most of you will know that we were one of 3 Wave 1 Pathfinders identified to implement and test and learn the government's transformation strategy for children's social care. That strategy was called Stable Homes Built on Love, and the government's implementation plan involved a number of authorities testing the approach before it was rolled out nationally. So there were 3 Wave 1 Pathfinders who went first with this model. We were one of those, and then there were 7 further Pathfinders identified who were known as Wave 2. The Pathfinder programme ended at the end of March 2025, and we designed our Pathfinder model, and it went live in 17th of June 2024. And since the end of the programme in March, it is now business as usual here. We have some adaptations to make to comply with the national guidance for the national rollout, because it differs to the minimum specification for Wave 1 Pathfinders. Paula will tell you a little bit about that in a minute. But as a test and learn Pathfinder, Dorset has been involved in leading and steering this national transformation agenda, and we're continuing to support the DFE with the national rollout, supporting other authorities around the country and mostly in the southwest region to deliver the reforms in their own local authorities. So I'll pass on for more detail from Paula.
Thank you, Paul. Paula Golding, Corporate Director for Care and Protection. So the report outlines how our local model is being adapted to align with the new National Families First Partnership Guidance. Primarily, that's in relation to the role of the lead child protection practitioner. So for Dorset, as a Wave 1, our specification was for the lead child protection practitioner to be case holding, and that is different for Wave 2. So we're working on that at the moment, and we're aiming to have full alignment with the new partnership guidance by March 2026. So in supporting the national rollout, we've been leading support across the southwest region, and we've recently welcomed BCP and Gloucestershire councils to come and visit and look at our model, and we've got a further visit from Wiltshire planned for July. We've delivered webinars nationally and attended steering groups to inform DFE policy and guidance, and we're also offering wider support programmes to other local authorities as sector-led improvement partners, which attracts additional funding from the DFE. We have the same funding this year as last year from the DFE to support the Pathfinder, and we're currently awaiting our financial settlement following the spending review. However, we are anticipating a similar funding envelope to this year. So the report highlights the early positive impact of the reforms for Dorset, including a reduction in the number of children entering our care in 24-25 compared to the previous year. We had 22 less children that came into our care last year. We've had a decrease in the number of children subject to child protection plans. We've seen improved timeliness of assessments through both targeted early help and child in need. We've had a pilot around our school nurses undertaking needs assessments for children subject to child protection plans, which evidenced that 41% of children on child protection plans had new healthy needs identified through those assessments, which was supporting earlier intervention. We've seen an increased use of family group conferences and family network meetings with strong positive feedback from families, and a reduction in overall caseloads for social workers and family help teams through supporting a broader practitioner base. And these outcomes have contributed to our Ofsted rating Dorset Children's Services as outstanding in March 2025 through our local authority inspection, with inspectors highlighting the effectiveness of the Families First model in empowering families and improving multi-agency decision-making. So we're recommending that the committee notes the report and supports the continued delivery and evolution of our Families First model, as well as our role in supporting the national rollout. Thank you.
You're doing my trick. Sorry. Thank you very much. I mean, next time if you speak, could you speak slightly slower? It's a really, a little bit too fast, because I think we've got actually improved mic system. I must say it is improved. But I think slowing down for some of us older ones might be handy. Thank you very much for that. Now, any questions? Yeah. Oh. Okay, we've got Ryan.
Thank you, Chair, and thank you very much for delivering the Pathfinder report to the committee. Certainly, it is certainly I welcome it, I just wanted to get in a bit more details on 5.5 of the report about the, because you mentioned there, and obviously as it's in the report, about these, obviously on the 11th of June when we had the spending review from government. Obviously it states in there about obviously the commitment for obviously for hopefully getting increased investment over the next few years. But what I just wanted just to see if we could try and clarify is that it doesn't state in the report about what the allocations, because it says it hasn't been released yet. So do we have any sort of indication of what our allocation is going to be? Because often I find when government does these allocations, it's incredibly frustrating when we find that Dorset tends to be at the bottom end of the pit, it does, when it comes to getting funding. So do we have a sort of indication of what our allocation could be, and what sort of certainty could we have, you know, in the next few years to come? Thank you.
Thank you. Paul Dempsey, Executive Director of Children's Services. No, we don't have any details on the allocation specifically for Dorset Children's Services. We expect that later in the year. I have already flagged that with the DfE as a concern of ours to find out as soon as possible. Worked very hard last year to emphasise the importance to the DfE of the sum of money that we'd been using in 23-24 being at least replicated in this year now, 25-26, sorry. The amount of money that's been announced is a national amount of money and will be allocated at some stage. The allocation last year, if we hadn't had a deliberate effort by the DfE to replicate the exact sum of money we'd had the year before, the way in which the formula works appears to be less favourable to rural councils like Dorset. So what I'm trying to say to the DfE is that won't work for us and it will be a reduced spending. So please can you do what you did this year, for this started April the 1st, next year, to leave us in a safe space to carry on with our model.
But thank you, Paul. Yeah, I think Ryan's got a secondary question. Thank you.
Thank you, Madam Chair. Yeah, I thank the Executive Director for answering that question, because that is my biggest concern. That is that as you just highlighted there, is that rural councils seem to be not getting the fairer deal of what some other councils are getting across the country. So I definitely implore, obviously your urgency to get clarification from the DfE. I think it would be, I think as soon as I think it would be very important if you could possibly report that back to this committee later this year, because I think it will give us, Madam Chair, then a chance to dig through into the numbers a little bit and then see where we can go from there. Because, as you say, that is it's vitally important that they recognise that that Dorset is plays a pivotal role on this, and it is important that we make sure that we're not going to lose out just because we're seen as a dominantly rural county. Thank you.
Just to mention there, when are you likely to get that, actual thing coming through? It says it's, has not been released, and that was the 11th of June when they did the review. So we're now almost a month on. Are you likely to get an answer or get any, result from that?
There's been no indication of timing for the allocation decisions. Last year it came reasonably late. I think it was something like January. So it was, late in the budget planning cycle that we got the exact details.
I think we have John. Next, John Orrell.
Yeah, so John Orrell, Malcolm Regis, very much supportive. It's a great report, very encouraging that Dorset's leading the way for the nation, so well done. Mine isn't a criticism, it's more of a clarification. It's page 13. It's about the child protection conferences. One of the paragraphs talks about the chairing of the meetings passing to social workers, not well received by families or the professionals themselves. Then later in the same paragraph, it almost seems to imply that they carried on with them chairing. So is that me misreading it? That's the first one. And the second one, the paragraph below, it says education being a key factor. I noticed that health isn't a key player. In the EHC plans, H is health. And I know from experience over 30 years, it's quite hard for health to turn up to some of these conferences from the timing and duration of them. Is this a reflection of the fact that health doesn't turn up to conferences? So that's the second question.
Thank you. So in relation to child protection conferences, we did a pilot for 9 months last year, based on the original specification from the Department for Education around case-holding social workers chairing their own conferences. It was really thoroughly evaluated, and we were able to feed back to the DFE that social workers chairing, although it worked, wasn't favoured by families and was also quite difficult to do in terms of presenting their reports and chairing the conference and representing the child. However, when we did the pilot, we also made some modernisation changes to the conferences, which made them much more family-friendly, more family-led. We did lots more preparation for families attending conferences. So we didn't roll out the chair bit, but we did roll out the other parts of the modernisation of conferences. So that's just to clarify. In terms of education being an equal safeguarding partner, so police and health are already statutory safeguarding partners, education aren't. So this was specifically around bringing education into that space alongside police and health.
Thank you. We have now Byron.
Thank you, Chair, and thank you for the report. This is my first time on this committee, and I'm aware the committee is designed to look forward as opposed to sort of scrutiny looking back. And clearly points that have been raised are talking about funding because that will dictate what you can do going forward. Now, it's my understanding that the recommendations we've put forward back to government about Pathfinder is somewhat different to where they thought it would be, effectively costing more in black and white terms. And it's highly unlikely that the government will come back and say, well, you were right, we were wrong, and we'll give you more funding. And I think that was kind of the point that was being made. And then the issue of the time in which you get told how much you're going to get. It's a sort of a double negative. So taking into account this committee and how this committee can support your service, I'm just intrigued to understand. Clearly, you would have been working in the background in case what you hope doesn't come forward. So what parts of the service that have been reported in here are you planning on, I don't want to say cut, but redesigning or et cetera, because the funding won't be there? Because I think that's probably where the committee, when it comes to this particular service, will need to look as part of our remit for this committee. So that's the first sort of point. Maybe a larger sort of conversation to go and maybe come back at a later date, because I know obviously there's a forward plan, and I'm quite keen to dig into this within the forward plan. It's something I'll pick up with the chair. So I don't know if you wanted to comment on that.
So yeah, we will be working on contingencies as we move throughout the year. Of course, the DFE are saying the same as they did last year, that they wouldn't want to see such a high-profile national leader in this transformation space being seen to not be successful as a result of any support from national government. But as I say, we don't know what the funding is going to be when we eventually get the allocation. We are needing to adapt and align our model with the national guidance that is part of the national rollout, because as it stands at the minute, as a Wave 1 Pathfinder with that different spec, our model doesn't fully comply. Where there's efficiencies we can make that still maintain quality, early intervention, prevention service that continues to keep families together and support them early in the way that the model is designed to do. But where there are efficiencies that we can make as part of that redesign, we'll make those efficiencies. But the best way for us to run an efficient, high-quality children's service is to invest our resources as early as we can with families to reduce crisis in families and reduce our need to pay for high-cost service. So we'll continue to push ever further and further into that avenue to maintain a best value children's service.
Thank you, Chair, and thank you for that response. So contingencies, at what stage is this committee brought into contingencies that you're looking at, or are we, or is it something that we have to ask to? If so, is that something we have to pick up with the Chair? Because those contingencies could be quite vast. And there are other departments within the council that clearly link in and have an impact on children's services. And I remember many times being quite frustrated that we were still working in silos. So I'm quite interested to understand that work that you're working on. When does this committee understand that there is another thread, and do we get to see what that thread is?
Shall I come in there, Paul? Yeah, I understand that the services, the children's services, are embracing this new concept a little bit with, the new government come in with this Family First partnership, which slightly alters the emphasis on some of the ways that they deliver. And actually, if you're looking in the paper, I already asked Paul the question a few days ago and said, there's nothing about family hubs in there. And he said, doesn't actually cover family hubs, that's a separate item. Well, to me, it should be all embracing, but that's something, again, that we ought to be talking about, but that's for the future. I'd already asked that. And also, as we were a pilot scheme, one of the ones that the government think we favour, we've done so well, and with the Ofsted, well done with the Ofsted, with the children's services, with an outstanding, I think that we are now leading the Southwest, and actually I did ask a question again, do we get some funding from the government to actually take this forward to the Southwest and giving them guidance? And that is quite a feather in your cap. Thank you. So I don't know if you want to answer, Byron, any questions there?
Okay. Yes, I'll answer a series of questions. So yes, we do get specific funding to support the national rollout. DfE have allocated us £190,000 for this year to support the national rollout. We also are a sector-led improvement partner, and we've been granted 100 days to do sector-led improvement work. Some of that will be Pathfinder work, and we get paid additionally on top of that for each day that we support another local authority, and we generate a good bit of income that way for the council. Where we're looking at cost efficiencies, as I tried to sort of articulate in my previous answer, we will look at doing that in a way that continues to invest rather than take away from early support services, so that we don't increase our high-cost crisis sort of intervention services. And where we've made more progress, be happy to talk to this committee, but you would appreciate that in early days like this, it's difficult to set out things in detail in what is a public meeting when we haven't done the work. So, but happy to report when we're much further down the line.
Chair, then I don't know if this question is for you. I get all that, and I appreciate that, and I've been involved with Pathfinder for some time as well, so I understand all the pressures and issues and how fantastic the service is. But my question within the remit of this committee is, and I take it this is a public meeting, so it's probably not something to be had now, but certainly sounds like something that needs to come on the forward plan, so that in-depth work can be taken in the background, is what contingencies, because I'm sure you have a very good idea what's probably coming, and you probably know what funding is coming. We're hoping, but we know what's probably coming. And I'm pretty sure you're working on Plan B. So my question is simple. It's not all about the other stuff. It's just simply Plan B. Does this committee get to look at Plan B, C, D, whatever we have? If not, do we have to request that on the forward plan? That's pretty much where I'm getting with this, because I think the point about the hubs, family hubs, is fantastic, because it makes no sense to me that, it didn't make any sense to me within Pathfinder, that it wasn't a joined up bit, because we could make decisions within this council that still supports Pathfinder with family hubs. So taking the remit of this committee about being forward looking, that's the point I'm trying to make. What stage do we look, or is it something we need to request and then do background work? That makes, if I've been at all clear. So it's not about the work that you've done in this report. It's just, what's Plan B? When will we get to see Plan B? Do we have to wait until we find out what the funding is? I presume we wouldn't, because we'll be working on Plan B now.
Well, I'm not quite sure about how to answer that, but the thing is, I think Paul's looking to me as well. I think we could bring this back as an annual report back. Do you think that would be a good idea? Would you be able to do that?
The committee can do informal work, so they can look at this in detail in informal meetings.
Right. So we could have a subcommittee, task and finish group. Would that suit people?
We can look at options outside the meeting to see what can be developed.
Okay. I think on George's advice, then, I will say we can set up an informal meeting or with a subcommittee of those that are interested and outside this meeting. So I will have a chat with George afterwards and we'll get some terms of reference of what is actually needed as well. Or should we have the initial meeting with that, with the terms of reference? Yeah?
I would say we should talk with Paul.
Talk with Paul. Right. Okay, we'll do that then. Thank you for bringing it up, Byron. Okay. Right. Paul. Oops.
Sorry, just to try and answer a bit more. We haven't got a fully articulated Plan B yet. When we have got a fully articulated Plan B, happy to share and discuss. It's very early on in the budget planning process for the council for next year. I do anticipate us getting at least the same amount of funding as we got last year. DfE have worked in partnership with us and tried to support us as much as possible. Their hands are tied sometimes, though, in terms of the timeliness of the decisions that the Treasury makes and when they can communicate them to us. But yes, we will have to think about what we do if we don't get the same amount of money. I would say that on family hubs, whilst we didn't report in this report on family hubs, they are very much a really essential part of our service moving forward. I think we have 7 family hubs operating now. We have a plan to deliver 11 fully fledged family hubs plus a number of community support networks. The ones that are open are working well. They are part of what we call our early support services alongside our voluntary and community sector and our local alliance groups, and part of our push and our means to deliver support to families as early as possible. So even before they come into our family help services, we want those families to get universal plus support in our family hubs with our voluntary and community sector, and we're working with partners in those spaces. So I agree that that's an important space, and we have previously received DFE funding to set up those family hubs, and I think the government announced further funding yesterday, I think, or at the weekend for family hubs nationally. Again, I'm not sure about the allocation that will come our way as yet, but yeah, they are an essential part of our service delivery.
Thank you for that information. And yeah, we'll carry that forward after the meeting. And anyone who wants to actually be part of that, then we'll welcome anyone. We have got now Stella, I believe.
Yeah. First of all, I think it was good that we were pilots to the Pathfinder scheme, because it means that our children are already gaining from what we've learned, whereas other councils are just kind of catching up. And if you just to look at some of the figures, when you look at the support more quickly coming in, targeted early help improved from 65% to 93%, and that's brilliant. And some of the other figures show that, you know, we really worked hard. But a lot of this depends on really good staff working. Do we have a problem getting staff and social workers? And also, at one stage, it mentions that school nurses. I think there was a shortage of school nurses at one stage. Are we okay with all these?
Thank you, Paula Golding, Corporate Director for Care Protection. So we have, there's always a national shortage of social workers, and we have our retention and recruitment strategy, which is led by our principal social worker. We think that some of the changes that we may need to make to meet the reforms will support some of that in terms of our experienced social workers. We are recruiting lots of ASYEs, lots of newly qualified social workers, and making sure that we've got the right support in place for them. In terms of school nursing, I think there is a shortage of school nurses, but there's plans in place to look at how we get best use out of those school nurses to meet the needs of our children. But we do have a very stable workforce in relation to our family workers and our wider workforce.
Thank you. Can I ask one more question, completely different? You do mention that the youth work study shows some early successes. What are those early successes?
So we did use some of our funding to increase the number of our youth workers. We've seen really positive feedback from our schools about the group work offer that's available for young people in schools, that's supporting reduction in behaviour, reduced suspensions and increased attendance. We've seen an increase in the outreach in our community, so detached youth work, and building those relationships with the young people, which we know are really crucial to supporting that early intervention. And we've also seen a reduction in the number of young people that are identified as significant risk of extrafamilial harm. So that's harm outside the home, around criminal and sexual exploitation, gangs, and that's knife crime and things like that. So really positive. It's an area of work that's been hugely positive for our young people.
We have now Steve Mercer. It's you next. Oh, sorry. Whose handset's doing what?
So just on the question of social work recruitment and retention, really important question. One of the other parts of the reforms was to look at the workforce as part of the transformation strategy, and the government have introduced a new set of regulations about agency social workers to be fully implemented from October this year, and that will mean that no one could be an agency social worker unless they've had 3 years post-qualification experience in a local authority social work service. That isn't the case at the minute. Someone who is newly qualified could go and be an agency social worker. And indeed, if you are a permanent social worker in a local authority like Dorset's and you left to become an agency social worker, you can't be an agency social worker for another council in the region. So one of our social workers wouldn't be able to leave the job here and go and work for Cornwall or Devon as an agency social worker for 6 months. So 6 months has to elapse. So we think that will help us to reduce our reliance on agency social workers. Last year, we spent significantly less on agency social workers than we did the year before. I'm anticipating that we'll have a similar success this year. Those are the kinds of things we'll be looking at in our budget in the round to support any potential gaps in the budget that Councillor Quayle was highlighting if we're not funded at the rate we are through the DFE for the Pathfinder model. But lots of work to do throughout the year, looking at the whole children's services budget in the round to make sure we deliver a good service next year.
I thank you. I think that is quite useful to know. That certainly closes the door slightly on people moving around lots. But yeah, and you get more, actually, people with experience.
Right, thank you. So Jindy Atwell, Coal Hill and Wimborne East. There's just a couple of questions I'd like to ask about sort of data. I'm always a bit dubious when we sort of say, this is what's happening, right? So like we've got all these improvements because we know there's quite a number of different factors that might actually equate to why we've got a reduction in numbers of people who need later intervention. So could I just have an example of, we've got percentages on here, but how many families, and I apologise if I missed this, and this was at the beginning, but how many families, for example, would we have had pre-COVID, post-COVID, and sort of now? Like, do we have figures for how many people were actually using the intervention with, rather than percentages, because 65% doesn't really mean much to me in terms of like 65% of what, but if I had actual numbers of families, that'd be really helpful, and kind of the trajectory that we've had. So really sort of seeing, is this bit having the impact that we're claiming it's having? Thank you.
So I don't have the figures to hand compared to pre-COVID, but I can tell you the figures in terms of children subject to child protection plans, child in need and early help. So over the last 12 months, we've seen a reduction of, so from April to March, we saw a reduction in child protection, of 16 children. So we've got 16 children less subject to child protection plans this March compared to the previous March. In relation to what else we've got, child in need, it's stayed similar, but that's okay because that's a lower level of intervention. In terms of early help, we've seen a reduction, but that is because we have reduced what we called level 2 assessments, which weren't ever ours, but we counted them as part of our work, and that work has moved into early support. So it's we have two levels of early help. So you have targeted early help, which is what used to be described as level 3, and that was where you need a family worker or someone from the local authority that would support you. And level 2 early help is where you would have early help supported by your school or your health visitor or someone else. So part of the reduction in our numbers is because we're not counting those in the same way, not because less people are getting support. Does that help? Yeah. Okay.
Yeah, it's just sort of, if we are as a council and as a society invested in trying to improve, outcomes for young people, then we kind of need to know, is it actually having an impact, because if it's, 65%, but it's like 3 kids, like how do we, and obviously every one child obviously matters, and we want to make sure that everyone is doing better overall, but it's just interesting to have an idea of how many families across the county actually need that help. And 16 may seem small, but actually that's quite a number of different outcomes for those young people that could be massively improved, which I think is wonderful. So thank you.
And I think we have Steve Mercer.
Paul, one of the numbers I remember from the 25-26 budget, because I remember looking at it with incredulity, which was that family hubs across adults and children were going to save £5 million. It was a very round number, which made me very, I wouldn't say suspicious, but it made me look at that number. It also talked about, so that was family hubs, it also talked about early intervention was going to save money as well. So what I can see in the report you put together here is actually a lot of that coming to fruition. You're talking about caseloads going down, children going into care going down, those types of things. When you were talking about budgets before, you were talking about reinvesting, but I'm just very conscious that the budget was predicated on taking advantage of a lot of those savings, not reinvesting them. I can understand why you'd want to reinvest them to improve the quality of support and care, etc. But that budget was predicated on taking advantage of those savings that you're now seeing. Where is the balance in that between the making the savings and reinvesting?
Yeah, thank you. I might have articulated myself in a way that you understood me differently to what I meant to say. So what I was trying to say is that if we move into a plan B of how we spend our money because the DfE reduces the Pathfinder funding, I wasn't talking about reinvesting as in spending extra money. I was just wanting to ensure that we are still maintaining a service that invests the same level or good enough level to support families early and not allow them, through lack of support, to get into a crisis situation. So it wasn't about spending extra. It was about maintaining a level of support. Now, yes, you're right that we have made savings or avoided cost in some instances through investing capacity to support families early, and largely the savings or the spend reduction or cost avoidance, whatever terminology we use, a lot of that has come out of the children's care placement budget, which is our highest level of intervention and our highest level of spend. Some children in care, their care placements cost thousands and thousands of pounds each week. So each one of those type of high-cost care placements we reduce, it's a significantly disproportionate amount of money we don't have to spend compared to spending it much earlier on in a family's journey. So our budget for this year, when we made it up, is made up of something like 11 million to account for pressures and growth and 9 million of identified savings, so service review savings, transformation savings. A number of those will be savings that come from managing our care population. So we have been, over the last 5 years, taking costs out of our care placement budget from some of those investing and transformation in early support services. And part of our managing our budget this year is to continue to do that. I can't remember a 5 million figure just on Family Hubs, but Family Hubs is part of our early support network to support families early. Another key pillar of the Pathfinder programme and the Families First partnership approach is to, as the strategy says, unlock the potential of the wider family network. So even where a child or young person may not be able to safely stay in a family home with mum and dad, we will be looking to work with extended families so that they're able to move in and live with nan and granddad or uncle or aunt or someone else who's a close family member for that child, so that A, it's a good outcome for the child being maintained still within their community with family members, and in terms of our budget, it's a significantly better value option than a high cost placement in a stranger foster family or a children's residential home. So those are the kind of strategies we've been employing and will continue to employ to avoid costly care placements.
Can I put a little bit of, sort of background on that? I think the family hubs were actually set up under the Pathfinder from the government. Was it 2-3 years ago? And I know that that was something that was set up under the previous government, and that 2-year window was finished in March this year, I believe. And so this is a new rollout with the new government of how they're thinking family first partnerships, but the family hubs are separate from that. So this, when you say, well, family hubs should have saved 5 million, it was an invest to save, and actually out of the 10 family hubs they were hoping to set up in those 2 years, I only think 6 actually were accomplished. And so we're still going forward, I think, with some of those. So if that helps, it is, it's a slight grey area that we're sort of going into in that. And that is not actually included in the report. So I think it's a subject that will be brought up later, isn't it, at a later date. Thank you. Do you want to come back?
Paul, if my inbox is a barometer of the quality of service that you're providing, the one area that I'd ask you to look at and just make sure it's fit for purpose in the future is EHCPs. I have one family in my village where I get it, the parents are just trying to get the best outcome they can for their son. But I will send you the details because I've refrained from sending you the email, but I've had to intervene and send emails and chase people within children's services 4 or 5 times because this family are not getting the support they need. So I would ask you, is that process fit for purpose, or is that something you can look at to make better?
Yeah, thank you. That's helpful. We are looking at our support for staff and families involved in EHCPs and children with special educational needs and disability. It is an area of pressure at the minute. You will know probably from the national news that it's an area of pressure for most councils around the country. We want to get it as right as we can locally, of course. As I say, we are reviewing how our support for families is set up and how we undertake EHCPs, etc. As we speak, we're doing that. I think government has promised a white paper in the autumn on special educational needs and disabilities. So we're expecting reform in that area as well as the reform we're delivering in children's social care. But yes, I will, and we are specifically looking at SEND provision at the minute, and I'm very happy for you to send some of those emails so I can address specific issues if that's helpful.
Thank you. No, I don't know if we've got any more questions. I've got one more question, if that's okay. I think I brought this up previously with you. It's about school nursing it's 4.2 and the 7th bullet point, I believe. You would say school nurses in Dorset now visit children often at school, and I did mention, well, how often? if they are on a child protection plan. Over a 5-month period, this has led to 41% of children on a child protection plan having a new health need identified, and it's got examples there. It's actually such a help if that's the case, but have we got enough cover with school nursing that covers the whole of Dorset Council? And how often do they visit? I mean, if you say over a 5-month period, is that every week, once a fortnight, once a month? I think I asked you to perhaps look into it, but if you could, I think that actually gives me hope if you're catching other problems with children in their school settings. That would be helpful. Thank you.
Thank you. So that specifically relates to school nurses undertaking initial health assessments following an initial child protection conference. So previously, school nurses would attend child protection conferences and may have never met the child before. What we put into place was that they would undertake an initial health assessment within 6 weeks of the initial conference to identify whether there was any new needs for the child, and that was the 41% of children that were assessed. A new need was identified, meaning that we could get earlier support in relation to those health needs as part of the child protection plan. So they don't necessarily visit those children on a regular basis. It's about undertaking that health assessment to identify what health needs the child has and coordinating the support around that.
Are the actual children seen with their parents or in a school setting without their parents?
It could be either or both, depending on the age of the child and what the child's comfortable with.
Thank you. Any more questions? Have now got the recommendation is to note the contents of the report and support maintaining our local families first delivery model, the alignment to the national guidance by March 2026, and our role as a Pathfinder local authority in supporting the Families First Partnership national programme. So do we all agree? Yeah. Wonderful. Byron, are we all agreeing? We don't need to have a proposer. Yeah? Yeah, thank you. And Steve? Yeah, thank you. Thank you, that's it then. I'll keep switching off. Thank you for Paul and his colleague for answering all the questions so well, and wonderful report. And I do hope that we will set up this, the other unofficial subcommittee and see if we can, tease out some of the things that some of the committee would like to talk about. So that would be great. Thank you so much for that. The committees, let's go on to the committee's work programme, number 8 on the agenda. If you note, we've got 3 papers coming up in September. So we've got our hands full on that meeting. Does anyone want to suggest anything else? Do send me or George a note if you would like anything else added that's anything that to do with people or health in the next few weeks, and we can actually suss out whether it's something that's suitable for overview in the next 6 months or so. Thank you very much. And so, no exempt business, George? No, thank you. And so, close the meeting at, before 5 to 3, about 7 minutes to 3. Thank you all for coming and have a really good evening. Thank you. Bye-bye.